Thank you so much, madam. So just a little modification in what you said. So I'm going to talk in general about the regulatory framework in regenerative medicine. It is a growing field and it applies to all fields or all areas of medicine at present. So whatever applies to one applies to others as well. So, but of course, what I'm going to talk is going to be a bit related to what we do. And as I told in the morning, I I'm the deputy director of Neurogen Brain and Spine Institute on a lot of work on brain and brain conditions, but we'll try to see how it can be applied to everybody. It is applicable to everyone actually. So we know what regenerative medicine, a lot of work, a lot of discussion is happening that the damaged part or the dysfunctional part of different parts. It could be endometrium, it could be ovarian. I'm going to talk about the brain to stimulate and replace the damaged cells using special cells. These could be bone marrow cells, this could be cord blood cells, it could be, we don't use PRP in brain, but PRP for endometrium, and to stimulate and make it more healthier so that it can function better. So stem cells are like stem of a tree, gives rise to branches, leaves, flowers. You need proper fertilizer, different types, embryonic from in vitro fertilization clinics. But of course, that is not to be used for clinical transplantation. However, cord blood and bone marrow as adult cells, very, very promising and very feasible right now. Not futuristic right now. But yes, induced pluripotent stem cells, still futuristic, lot of promise. So all these has been discussed, what are the ways, but importance is that this field of regenerative medicine looks at trying to meet the unmet needs. So you have tried a lot of things, but yes, they work partly, but a lot of things still need to be answered, and that's where the field of regenerative medicine comes in. It is evolving, it has been evolving, and so does every field, isn't it? Every field evolves, and the evolution is how do we take it ahead? Do we stamp on the evolution or do we let it grow? Or do we let it grow with pruning and proper systems, or we just let it dry? That's where all the regulatory work, regulations, where are they inclined towards is going to be very, very critical. And for us to understand, especially as clinicians, practitioners, in today's or in all these discussions, I've seen so much of evolution and innovation in the field of gynecology that I'm amazed. So a radio frequency, which I don't really understand so much about, or a diode which can be used for skin, can be used for gynecological conditions, and that's the evolution I understand from what you're all discussing is from your own practice, which has come out for the betterment of your patient. So in field of regenerative medicine, different kind of stem cells have evolved, and there is so much of research happened, and it has received 3 Nobel Prize. I think that is something to think about. Even our Harrison's textbook of medicine talks about regenerative medicine, worldwide publications. 291 in neurological disorders, orthopedic condition, 130, wound healing, 126, and of course, gynecological conditions, still upcoming lot of evidence. We heard both Dr. Rita Bakshi and Dr. Jyoti Malik talking about the different, some anecdotal, some studies which are available, maybe around 15 broadly is what we understand. But yes, why I put this up is that yes, a lot of evidence still needs to be created, but it can be created as you go ahead. Looking at safety first. In neurological condition, which is my forte, autism, almost 29, 30 publications, cerebral palsy, 35, muscular dystrophy, 33, spinal cord injury, head injury, brain stroke. Dr. Rajput will talk about muscular dystrophy and spinal cord injury. I'll focus a little bit upon autism and cerebral palsy. Again, adult stem cells. We are talking all about adult stem cells, isn't it? PRP, bone marrow, adipose tissue. These are all adult stem cells, safe, non-tumorogenic, no rejection, easily obtainable. And no ethical issues. We are not killing an embryo. We are not using an embryo. We are not really. So this is what I hope this plays. Stephen Hawking talked about in regenerative medicine, really, really inspiring.
I have spent my life exploring the mysteries of the cosmos. But there's another universe that fascinates me. The one hidden inside our bodies. Our own personal galaxies of cells. Today, we are on the brink of a new age in medicine. an age where we will be able to heal our bodies of any illness. All because of cells inside us,
which have special powers. They are called stem cells.
As we all know, Stephen Hawking, who unfortunately is no longer with us, has himself suffered from amyotrophic lateral sclerosis or motor neuron disease, and he was a big supporter of stem cells. So bone marrow aspiration, you have seen from posterior, we do from anterior superior iliac spine. We use a method of gradient separation, and then injecting intrathecally. So this is just to give you a little bit about why I'm talking about this is because even for regulatory work, for regulators to take us seriously, we need evidence. We need a lot of studies. We need research. So as clinical practitioners, I plead with you, I would like to appeal that please put all your experiences into research, publish your papers, because that's what is going to give you strength to be able to stand in front of everybody and tell this is what works and this doesn't work. So that's why our publications for example, in autism, there is 80% evidence from all different publications. There are so many publications. First from India, we have to be proud of that. We always look at the West, but West is looking at us today. First in the world on autism from Neurogen from India, second from China, third from US, fourth from US, then from Mexico. So it goes on and on, almost 10 such publications. This is just to show, because I want to come finally, of course, our published literature also almost 254 patients shows very good results. So this is what Dr. Rita was referring to in the morning. We do objective evidences, brain scans to show before and after. So before you can see the blue areas are damaged, and after 6 months you can see that the brain functioning is improved. This is in 16 publications, improvements. A 11-year-old boy who came to us is now 19-year-old going to college. He's in the US, he came from US to us. His father is an interventional cardiologist. This is a child from South Africa who came to us at 4 years, completely non-verbal, and now you can see in the next video that he is speaking completely. This is a video that he has recorded.
Once upon a time,
he has recorded it himself.
Kid was walking down the street and his brain.
This is just to give you a glimpse. I want to go directly to the regulation, but this is important to know what is possible if you put together your data. Cerebral palsy, as gynecologists, autism, cerebral palsy is finally, you do see your patients coming back to you, right? So it is important for you to know what happens finally when your other patient comes, they come for the second time or third time. So brain damage before the treatment you can see, and after 6 months the brain functioning is improving. So these are all studies. This is just to show in book chapters. Now, what is the present position of stem cell therapy in the world? First important thing is we have to be able to distinguish stem cell derived products from stem cell procedures that you and we do, and stem cell research. This distinction is very important for us to understand what can be done and what cannot be done. So stem cell derived product, stem cell procedures, and stem cell research. So what is the Indian scenario and then the international? Indian scenario, there is no consensus between the stakeholders. We have the ICMR, then we have the DTAB, the Technical Advisory Board from the Ministry of Health, then CDSCO, and of course the Ministry of Health itself. So ICMR guidelines, of course, started from 2007. First they were known as Guidelines for Stem Cell Therapy, Research and Therapy. That was 2007. And 2013, the therapy went away. ICMR said, they are only looking at research. And 2017, again, research. What is the most recent? 2023, May. ICMR put around a referendum for public opinion saying that they will not play a regulatory role in the stem cell research. So ICMR is more for guidelines, and it is looking at handing it over to the DGHS. What does the Ministry of Health and Family Welfare say in its new drugs and clinical trial rules in 2019? What it says is this: a vaccine is a derived product. It is a modified monoclonal and stem cell derived product. These all will come under drug. So stem cell derived product will come under drug, not the stem cell procedure. So stem cell, what is stem cell derived product? So that's where the DTAB comes. The DTAB clarified the definition. The Drugs Technical Advisory Board clarified the definition of a stem cell derived product. So let's look at what they say. This is a committee which was set in 2019, and this is what, okay. So the DTAB says that routine practices, transplantation, surgeries, therapies undertaken by doctors involving stem cell for treatment of their own patients and not for commercialization of the same outside their own hospitals or clinics fall outside the purview of the Drugs and Cosmetics Act. So this is very, very important as clinicians for you to know. Also, they clarified that stem cell derived product, at that time they said that it will be brought by ICMR, and there should be a state licensing authority which will look at the stem cell derived product. It is very important. It is inappropriate to intervene from regulatory angle on routine practices, therapies, surgeries, transplantations undertaken by registered medical practitioners, physicians, doctors in their clinics, hospitals involving such stem cells for the treatment of their patient based on their medical expertise. This is something very few of us know about. Okay? Again, the next one. Based on the recommendation of the 84th DTAB in its meeting held in 2019, and again in 2021, it has issued directions to all principal health secretaries that there should be a clarification of what is stem cell derived product and what is stem cell procedure. Who supports stem cell therapy? The Prime Minister Modi is a big supporter of stem cell research and therapy. Our Honorable Health Minister, the Drug Control General, the previous Indian Medical Associations has also, in Bombay, has published a book, Mahima, with a full chapter on stem cells and Stem Cell Society of India, or now the Society of Regenerative Sciences. What I'm talking to you about is courtesy the Society of Regenerative Sciences. Dr. Rajput is here, who is one of the prominent, in the governing body of this, and of course Dr. Sharma. So this is of course from Dr. Sharma's talk. So Pranab Mukherjee, our ex-president, actually spoke in the parliament and outlined that out of the 5 main research topics, stem cell and brain research would be one of things that the government would be supporting. Our Prime Minister went to meet the Nobel laureate, Professor Yamanaka, in Japan, and work is happening in the National Center for Biological Sciences. He, in fact, the Prime Minister had supported in the civil hospital Surat creation of a stem cell therapy center way back in 2011. Unfortunately, it is not functional. He, in fact, wrote a preface for the book that we have written on muscular dystrophy, translated in Gujarati. The health minister, when we had the conference, the 3rd conference of the Stem Cell Society, the health minister wrote a preface where he talked about the use of stem cell for various conditions, that it should be, that India should play a leadership role. Even at that time, the Drug Control General of India, Dr. G.N. Singh, also said that it is important and it should be supported. In the 4th annual conference of the Stem Cell Society, the Honorable Health Minister again wrote that it was Prime Minister's dream that India should be, proponent of stem cells, especially for disabled persons as well. So all these different supporters, and we had in fact written a stem cell therapy for neurological disorder. We had made a full chapter on a full book on for the for giving the doctor community a glimpse into the potential of this field. Now, international scenario, I think, because we all look to the West, isn't it, for everything, but a lot of work on regenerative medicine, and I will end with that as to why has happened in the East. So Japan, Korea, India, China, a lot of work. So let's look at what Japan said. So Japan made a very, very path-breaking differentiation and said that daily practice should be different from clinical research and from marketing. And in daily practice, gave conditional permission to do for a certain amount of time. You get your evidence, and then it can be made into a permanent solution. So that's where the difference that Japan went ahead and made. Korea just said that cell therapy products means a medicinal product manufactured through physical, chemical, or biological manipulation, such as in vitro culture of autologous, allogenic, or xenogenic cells. However, this definition does not apply to the case where a medical doctor performs minimal manipulation which does not cause safety problems of autologous or allogenic cells in the course of surgical operation or treatment at a medical center. So minimal manipulation, that is only separating the cells and injecting, as you do in PRP or in BMAC, doesn't come under the drug. USA. We look for whether it's FDA approved. Let's see what does even the US law say, what does US courts say about stem cell and especially autologous cells. USA has a Charlie's law which says that the treatment of, yes, this is the last few. So this says that the treatment requirements, this is Charlie's law in Texas, that if done by a qualified physician with the institutional review board, this is very important, institutional review board in a licensed hospital with a surgical center, this treatment can be performed using autologous cells. Okay. This is for investigational stem cell treatment to patients with chronic disorders and terminal illnesses. The second was the USA Right to Try, which was released by Trump and Donald Trump, where he says to authorize the use of unapproved medical products by patients diagnosed with a terminal illness in accordance to the state law. Recent US court judgment says there are no FDA approved or disapproved surgical procedures. So surgical procedures do not come under the ambit of the US FDA. Not now, nor have there ever been any approved new drug applications for surgical treatments. So for surgical treatments, ethically, what are we allowed to do? The World Helsinki Declaration, which involves ethical principles of medical research involving human subjects, says that where proven interventions do not exist or other known interventions have been ineffective, a physician with expert advice, informed consent, may use unproven intervention in the hope of saving life, re-establishing health, or alleviating suffering. That's what we are doing, isn't it? Intervention should be made an object of research, so safety and efficacy should be. So you must put it up as a research as well. So our Prime Minister, he spoke in the Parliament.
तो जापान मेरे कार्यक्रम में मैंने एक कार्यक्रम क्या जोड़ा, मैं वहाँ एक नोबेल लॉरिएट साइंटिस्ट याकामाहा को मिलने गया। मैं इसलिए किया गया कि उन्होंने स्टेम सेल के अंदर जो रिसर्च की है, मैंने जितना पढ़ा था तो मेरे मन में आया था शायद इनकी एक खोज हमारे काम आ सकती है क्या है। हम गए तो वहां गए, उनसे चर्चा की और बेंगलोर के हमारे साइंस इंस्टीट्यूट के साथ आज उस दिशा में हमारा काम हो रहा है कि स्टेम सेल्स के द्वारा हमारे युवा साइंटिस्ट।
Let's see what President Obama said, because there's a lot of it that it was banned in the US, but people don't know that the ban was reversed.
Today, with the executive order I am about to sign, we will bring the change that so many scientists and researchers, doctors and innovators, patients and loved ones have hoped for and fought for these past 8 years. We will lift the ban on federal funding for promising embryonic stem cell.
So this is what I wanted to end with, because it's just good to end on a positive note. Thank you.
Thank you, ma'am, for giving us the overview what is going on around the world.